Welcome back. Hawaii Care Choices needs 20 more nurses to work with very ill patients. In tonight's Aging Well, Diana Ko learns why the Hilo nonprofit says the demand for nurses who make house calls has skyrocketed during the pandemic.
Nurses from Hawaii Care Choices make house calls to hospice and palliative care patients like Debbie Kenui.
They come into my home or they make a phone call. They can be my advocate, and I have a safe place to say, okay, I'm not feeling well.
Many high-risk patients like Kenui are asking for the medical professionals to come to them now.
They call us, and as a result, we've tripled in the amount of patients that we have serviced.
Weigert says the request for Hawaii Care Choices services during COVID-19 is overwhelming.
This has actually changed the way that people are accessing health care now. That has been driven by the consumer now due to what is happening with COVID.
Weigert says sick patients don't want to be isolated from their families during the pandemic.
Because of how the different clinics, hospitals, and long-term care facilities are dealing with their patients, they have very strict rules for any additional visitors, particularly our long-term care facilities.
Hawaii Care Choices has a statewide campaign to hire 20 nurses.
It's been quite challenging and very rewarding because we know that there is such a need out there, and we feel quite humbled that we are able to reach so many now.
You have to move to Hilo for the job, but Weigert hopes to convince people.
Our cost of living is so much better, and it's definitely not a rat race in Hilo.
Kenui says she definitely appreciates the work those nurses do.
They empower me to keep fighting the fight.
Diana Ko, KITV4 Island News.